So our blood glucose levels were 252, which is a little high. So we will continue with insulin administration now. We'll look at our orders in the MAR and compare them with our findings and identify our patient. We performed our hand hygiene and donned our clean gloves. And then we'll perform our focused assessment. Since we had a high blood glucose, we're looking for signs of hyperglycemia, which would be a blood glucose over 130, polydipsia, dry mouth, polyuria, polyphagia, and then signs of hypoglycemia, which would be below 70 blood glucose. It would be signs of sweating, dizziness, confusion, tachycardia, things like that. All right, and we will also continue our focused assessment by looking at the injection site, the previous injection site, and looking for signs of bleeding or infiltration, infection, things like that. And then we'll rotate to another sub-Q injection site. Now, insulin can be given several ways, via insulin pump, inhalers, syringes, pens, and it can also be given sub-Q or IV. Some sub-Q sites would be like the buttocks, abdomen, on the back of the arms, any high fatty areas. But for this video, we'll be going into the patient's right abdomen. All right, so we pulled our medications. We have NPH, we're gonna do 16 units, and regular insulin, we're gonna do 6. And we'll check our expiration date of our vials, and we'll also roll our vials to make sure they're mixed thoroughly. All right, and we have our insulin syringe here. Insulin syringes are easy to identify because they use units instead of normal milliliters. All right, so we've disinfected our vials, and we're going with 16 of our NPH and 6 of our regular insulin. So we'll draw back 16 units of air, inject into our cloudy NPH first. All right, and 6 units of our regular insulin. Okay. And we would actually leave the syringe in for the regular. And then we would turn upside down, draw back 6 units of our regular clear. Trying to get any air bubbles out. And then 16 of our cloudy. So that will be 22 total. At 20, okay, so we have our insulin vial ready. We will double check with another nurse to get another nurse to verify our insulin dosage, and we have 22 drew up here. All right, and if we would be pulling this up outside of the patient's room, we would label the syringe and make sure that we have the correct syringe and insulin labeled and dosage. All right, so then we will go inside the patient's room, perform our third and final check at the bedside, confirming patient, dosage, medication, and with the MAR and orders. Explain the procedure to the patient, and then we will clean our area with an alcohol wipe, the right abdomen. All right. Clean 30 seconds. Now we'll pinch up the skin for a sub-Q insulin injection. Now if we get 1 inch skin pulled up, which we have now, we'll go in at a 45-degree angle. Now if we got 2 inches, which would be more, we could go in at a 90-degree angle, but for this insulin injection, we'll go at a 45 degrees. And administer slow. All right. And we'll cover that up with our alcohol wipe. dispose of our syringe into the sharps container. All right. And then we will make sure that there's no bleeding at the site. Done with our vials. We'll ensure that the patient isn't having any kind of reaction and that their symptoms are improving. Take off our gloves. Perform our hand hygiene once more, and then we'll document everything that happened in the procedure, how the patient tolerated the injection site that we used, and the blood glucose readings before, and we'll probably take one not too long after.